Hi viewers, I'm removing my mask as there's nobody else inside this room, and I would strongly advise you all to wear mask all the time when it's appropriate and use sanitizer when it's needed and follow all the social distancing and regulations advised by the health authorities. To introduce myself, I'm Dr. Vikram K. Venkatesh, Senior Consultant, Pediatrician and Neonatologist, is a specialist in looking after kids and newborns from birth. I'm practicing at Apollo Hospitals, Chennai, both Apollo First Med Hospital and Apollo Women and Children's Hospital, Chennai. And I also practice at Krishna Kids Medical Center, looking after newborns. That's my main area of expertise. The current hot topic I think we all have was about COVID-19 in children. There are a lot of parents, general public, a lot of other media houses, channels, newspapers are all discussing about what's going to be the impact of COVID-19 in children. So I thought I'll do a short video from a medical perspective, looking into the facts, the evidence and the science about COVID-19 in children, and try to I could clarify and probably some of the concerns or the queries which parents do have. So I'll probably go one by one looking at the common questions and queries that most of the parents do ask me. Number one, does COVID-19 impact in children? Do they get COVID-19 disease? Yes, children do get COVID-19. We do know that in the first wave and in the second wave, we did treat many children with COVID-19, but the good thing is predominantly most of them were quite well. They didn't need to come into hospital. They were managed at home. The next question I think would be is, what are the symptoms of COVID-19 for children, especially in compared to adults? We do know that what are the symptoms in adults. In children, there could be different categories of symptoms. Some of them actually do not have any symptoms at all. We call them asymptomatic patients or asymptomatic kids. But the only problem is they could be carriers. They could be infecting other people, other kids or other adults at home as well. The second category is mild symptoms where they do have a mild flu-like illness like a cold or a mild cough. They could have a fever for 1 or 2 days and they recover on their own without much of treatment. The third group would be moderate, where they have more symptoms. They have excessive cough, very high fever for more than 2-3 days, or other symptoms like vomiting or diarrhea. And the last group is what we call the severe category, where they have quite severe symptoms that could be even breathing difficulty or very high fever not settling for more than 3-4 days, or the child getting very dull, lethargic, needing to come into hospital. The first two groups, the asymptomatic and the mild patients, can be managed at home just with symptomatic treatment, good rest, lot of fluids, plenty of fluids, hydration, and they actually recover without much treatment. You could possibly consult your pediatrician or your healthcare provider, either in person or through a teleconsultation mode, but to make sure that you do the right monitoring for the child as required. The moderate and the severe category of children need to be assessed by a healthcare provider, whichever way it is appropriate, and has to be managed appropriately. The general treatment for COVID-19, especially in kids, is just supportive care. Probably you might need some paracetamol to manage the fever, which will be there for 1 or 2 days. But otherwise, it's mainly, I think, supportive care, a lot of rest, a lot of fluids, hydration, and that's more than adequate in most of the children. A very small proportion of them do get very ill, have severe symptoms, and need to come into hospital. That's a very small proportion. For example, I would say that we managed a lot of children with COVID-19 in the second wave in May and June 2021. Most of them were just managed at home and they did very well. They recovered very well. They didn't have any major complications at all. A very small number of them, in fact very few of them, needed to come into hospital, and even those few also did very well and got discharged healthily, and they do not have any major complications to be noted. Next question that people are asking is, what's going to be different in the third wave? But the now current hot topic is COVID-19 in children. What's going to happen in third wave because they are not vaccinated? Is there a reason for them to have more severe symptoms in the third wave? I doubt because I think so far kids have been very well protected. They, for a lot of reasons, probably we don't know very clearly. Probably they have a better immunity, or other thing is whether they have been had a previous other viral exposure, which helps them to treat, manage or prevent severity in COVID disease. Or it is just they have a healthy pair of heart and lungs, which is possibly one of the explanations for COVID-19 being mild in children compared to adults. The next other hot topic is, I think, schools. What do we do? How long we keep the kids out of school? So it's probably not a great idea to keep them out of school for too long. We do see a lot of issues because of that. So homeschooling or teleschooling, online schooling is probably not very appropriate, because first of all, not all of them will have the resources or access to them. So the uniformity of education, or school education, which every child in this country should get, might not be delivered because of the system. So there are a lot of discrepancies in the way it's delivered in both the state school system and the private school system. So there are some issues in that. And the social stimulation and the other required exposure which kids need in the form of school as peer groups or other friends, or that kind of one-to-one interaction in school, is also missing. So we need to try and see and make sure that we do send our kids to school when it's appropriate and in a safe way as well. So I thought I'll just probably briefly look at two things. Why are we concerned about sending kids to school? First thing would be, if my kid gets COVID, what should I do? We do know that a lot of children have got COVID. In fact, there's a very large study done in thousands of children in England with COVID-19, and they found out that most of them did very well. They did not need even to come into hospital. A very small number, very small number, got severely ill. That too, those kids who had other health problems, other chronic health problems. So we do know that kids are generally safe with COVID compared to adults. The other concern we have with kids is kids being carriers. This is a common statement a lot of people are making. Kids can be carriers. They can pass on the disease to adults and other vulnerable, old people at home. But actually, a lot of studies have looked into whether kids are more infective compared to adults. In fact, they found out that the kids less than 18 years are less infective compared to adults. So as an adult, you could spread the infection to more people compared to a kid who can spread. So I think the infectivity of kids is probably lesser. So we do know that children are safe with COVID. Most of them do very well, do not have any complications. They don't even need to come into hospital. And we do know that kids are not infective as adults. So I don't think there's any reason not to send our kids to school. But I think at the same time, we need to be very responsible, because I think schools have a lot of responsibility. At the same time, students and the parents also have a lot of responsibility. So we need to make sure that the schools are safe, social distancing measures are very well followed, sanitization measures are very well followed, and I think mask wearing, I think we should train our kids and making sure that wear the mask all the time as appropriate, and we need to educate them very well about these social distancing, sanitization and mask wearing measures. And the other thing which we need to do is, as parents, it's very commonly we see, even our child is ill, we try to send them to school. Yes, we do know that we do not want our kid to miss school. At the same time, when our child is having any infective symptom, leave alone COVID-19, obviously COVID-19 is more infective than any other virus, it is better to avoid contact with other kids or school. But with COVID-19, I think we have to be very careful. If we have any symptoms in our kid or child, or if there's somebody in the household having symptoms of COVID-19, we should isolate and quarantine them and test them and isolate and quarantine them immediately. And we should inform the school as well, so that they would actually probably quarantine those people who came in contact with that particular person in the last 3-4 days. So I think it's our responsibility to inform the school if you have any symptom of COVID-19 in the kid or child, or in any household family member, so that appropriate quarantine measures are taken in the school as well. So that's that. I think to summarize, COVID-19 in children is probably, I think, it's probably going to be the same as we've seen in the first and second wave, even in the third wave. So I do not think there's any reason to believe that it's going to be more severe in kids in the coming, probably coming few months. But still, I think we need to make sure that we are safe against COVID-19. We do not lessen our guard in fighting COVID-19. So we need to make sure that all of us follow the sanitization measures, wearing masks appropriately all the time, and making sure that we follow strict social distancing rules as good as possible. And the final thing, especially for kids, is I think we need to make sure that when we have symptoms, we need to isolate and quarantine ourselves, our kids, so that we do not spread the infection to others. I hope that this video would help our parents to alleviate their fears about COVID-19 in children, and also enlighten them about the risk of sending them to school is probably far much lesser than as we think about it. So I would probably make sure that we send our kids to school as safe as possible, and we also would make sure that we also keep our protection of the guard against COVID-19 as we are doing, so that we can combinedly win over COVID-19. The last and final point I would want to make is vaccination. I think that's another hot topic. I think we as kids, as pediatricians, we've been vaccinating our kids from newborn up to 2 years, 5 years, 10 years, and go after that as well. So with COVID-19, the current status about vaccination is there are 2 vaccines currently which has been approved for kids. That is Pfizer and Moderna vaccine, which has been initiated in America or US, and also in some European countries. But currently in India, both the vaccines are not available, and the current kind of guideline by the Indian government is they've not released any guidelines regarding vaccinating children. So we would have to wait until we get any guidance from the health authorities. So as soon as we probably get the guidance from health authorities, we would probably start vaccinating kids mostly from 12 to 18 years as they advise us. So currently there is no approved vaccination in India, and we do not have a guideline from the government of India regarding vaccination for children. But I think until then, we can still protect ourselves with safety measures like sanitization, wearing masks, and social distancing. I hope this video has been helpful to a lot of parents and the general public, and probably I think we would have alleviated some of the fears and concerns you had. And thank you.